Everybody okay if I begin? All right. Good afternoon. Thank you again for coming. I'm Janine Beck, Assistant Vice President for External Relations. Our primary focus this week has been to ensure that our campus is prepared to respond to any cases of COVID-19 and to protect the safety and well-being of our students, faculty, staff, as well as our patients. And we've been working diligently to move as quickly as possible towards the ability to deliver virtual or online instruction. Today we have 3 campus leaders joining us to provide an update on the university's plans and preparation. Montse Fuentes, the UI Executive Vice President and Provost. Rod Lennertz, UI Senior Vice President for Finance and Operations. And Teresa Brennan, Chief Medical Officer at the University of Iowa Hospitals and Clinics. Each will give brief remarks and then we'll take your questions.
Good afternoon. It's been a busy couple of weeks on campus, and we want to make sure that we keep you informed of the latest at the University of Iowa. We'll each go through some pertinent, timely points based on our progress through the COVID-19 issue here on our campus and our community. We want to make it very clear from the very beginning, our primary objective is to protect the health and safety of our community while continuing to provide a world-class educational experience for our students. Following the identification of COVID-19 cases in Johnson County, the University of Iowa is suspending face-to-face instruction for 2 weeks following our spring break. The university will move to virtual instruction beginning on March 23rd, 2020, and will continue online courses through at least April 3rd. This means following spring break, students may choose to stay home, return to their campus housing location if it's in a residence hall, or off-campus housing or another location of their choosing. We are making this decision proactively to maintain the health and safety of our students, our faculty, our staff, and patients at the University of Iowa, and in conjunction with the Governor and with the Board of Regents, State of Iowa. We will continue to follow the recommendations of the Centers for Disease Control and Prevention and the Iowa Department of Public Health, and the university remains fully prepared to diagnose and treat any potential patient that might be affected with this virus as the needs arise. During this time of online instruction, our residence halls and dining services will remain open, and we will also continue to operate CAMBus for our university community. We urge students to make their choice about the best place they can stay for their personal health and safety during this period of time. The university is preparing plans for telecommuting opportunities when appropriate for faculty and staff. Faculty and staff who have questions should direct those to their supervisor or to local human resource representatives. Many of their questions can also be answered at the UI's COVID-19 website, coronavirus.uiowa.edu. In the healthcare environment, the primary consideration is maintaining patient care and safety. University of Iowa Hospitals and Clinics, including Iowa River Landing, our dental clinics, and student health services will be communicating directly to their employees about next steps. UI Healthcare may determine that additional precautionary measures are necessary to protect patients' safety in the event of a campus emergency, including a public health emergency. Healthcare employees should consult their supervisors and HR representatives for relevant information and updates on the matter. And as I said last week, we again want to reiterate how fortunate we are to have a world-class premier medical center on our campus with some of the foremost experts in epidemiology, microbiology, and immunology. We have a plan, we are executing it, and we continue to adapt as necessary with the news that we gain. Now I'd like to introduce our provost, Montse Fuentes, who will share some additional details about moving to online education. Thank you.
Good afternoon. Thank you, Rod. Since the onset of the coronavirus cases in January, our primary focus has been to keep our university community safe. That's been our top priority. And many individuals on our campus have been putting in long hours reviewing our continuity plans, testing our IT systems, and ensuring we have the support mechanisms in place to change how we operate if necessary. We are now at that point, and I want to thank all the faculty and staff who worked so hard and helped us to get here. As Rod shared, beginning March 23rd through at least April 3rd, lectures, discussion sessions, seminars, and other similar classroom settings will move to virtual instruction to the greatest extent possible. We are currently evaluating how to handle things like science labs or computer labs, performance classes such as music, dance, art. We will be able to provide specific guidance about how to handle those classroom experiences by the end of the spring break. At this time, I also want to announce that there will not be change to clinical rotations or clinical instruction. This is a critical part of a student's training. However, we are taking additional precautions to ensure their safety as they treat patients. We are also currently in the process of sharing additional information with our faculty who need training or support moving their class to a virtual format. And they, in turn, will communicate with their students about how specific classes will be held as we move forward. We certainly continue to monitor and prepare for additional cases in Johnson County, and we will adjust the university schedule or classes as needed. I would encourage you to continue checking our COVID-19 website for updates and other information. During this period, I also want to emphasize that our campus will remain open to serve those who rely on the university of our hospitals and clinics, library services, and recreation and athletic facilities. Student health will also continue to serve as a resource for those on campus who may have specific questions related to COVID-19 or their personal health. Any students who are concerned they may have been exposed to the virus, please call the Student Health Nurse Line prior to visiting in person. We are also prepared to receive questions from students and parents via the Student Health email. If any faculty or staff believe they may have been exposed to the virus, we are directing them to call their healthcare provider or the UI Hospitals and Clinics Integrated Call Center to inform them of their travel history and symptoms. The University of Iowa strives to be a very welcoming and inclusive campus community, and it's very important for all of us to avoid any type of assumption about who may or who may not be carrying the virus based on their identity. We'll also continue to encourage members of the University of Iowa community to strongly consider deferring any personal, non-essential international travel during the spring break and in the months ahead. I also want to announce that the Board of Regents issue a rolling 30-day suspension of university-sponsored international travel effective March 5th, 2020, and this decision will be evaluated week by week. Earlier today, the university made the decision to recall all students studying abroad in Spain, France, and Germany due to the COVID-19 outbreak. While the CDC has not yet raised the travel risk to a level 3 due to the coronaviruses, universities reserve the right to act beyond their guidance in order to preserve the health and the safety of students. We have been monitoring confirmed cases abroad through the CDC risk assessment website, and these decisions were reached based on data signaling increased spread on the virus in these countries. We are asking that all our students leave Spain, France, and Germany immediately and return to the US by Monday, March 16th. We understand that this cancellation will no doubt cause distress and disruption, but our first and top priority is maintaining the health and the well-being of our students. We have communicated directly with the students impacted, and that messaging will be posted on the landing website. Out of abundance of caution, the university will also ask these students to self-isolate upon their return for 14 days. This means staying primarily indoors, avoiding direct contact with others, and not resuming social activities until the self-isolation period ends. Thank you. I would like to call now Dr. Teresa Freeman, our Chief Medical Officer.
Thank you, Provost Fuentes. As was said, I'm the Chief Medical Officer of the University of Iowa Hospitals and Clinics, and I'm going to speak about University of Iowa Healthcare. The safety of our patients and employees is the top priority of University of Iowa Healthcare. With more Iowans testing positive for influenza and the 2019 novel coronavirus, also known as COVID-19, we remain prepared to treat those who need our medical care while keeping our patients, employees, students, and trainees safe. We are currently caring for a patient with COVID-19, the illness caused by the new coronavirus at the University of Iowa Hospitals and Clinics. The patient is in isolation, which means that other patients are kept at a safe distance, and those caring for this individual are properly protected. We were aware of this patient's illness before they arrived at the hospital, so our care team had the appropriate measures in place and time to prepare. We continue to follow the advice of the World Health Organization, the Centers for Disease Control and Prevention, the Iowa Department of Public Health, and our own clinical experts. We are committed to protecting the safety of our patients, staff, trainees, and visitors. We will take appropriate steps which may include additional visitor restrictions and screening of those who are entering our hospital. Everyone can play a role in keeping our community safe. We're asking people to follow our visitor rule and practice good hand hygiene. Use a tissue or your sleeve, not your hands, when coughing or sneezing to cover your mouth and nose. Wash your hands often. This can be done with soap and water, lathering for 20 seconds, or with hand hygiene gel. Also avoid touching your face. As usual, the University of Iowa Hospitals and Clinics is available to provide care for a wide variety of conditions facing our Iowans. We are committed to maintaining the same level of care and excellence for all of our patients. Thank you.
We can take your questions now, and for those who might be watching later online, I'm going to go ahead and repeat your questions so that those can be heard by the audience later on. Yes.
Earlier today, I spoke to some students whose parents are concerned about graduation and booking flights to get to graduation ceremonies. Any idea of when decisions around that will be made?
The question is when we will be able to make decisions regarding commencement ceremonies and graduation.
I'll take that. If we actually determine that graduation will present a risk to public health, we will find an alternative venue to celebrate our graduating seniors. So we'll have a way to celebrate it. So we'll be evaluating this and presenting an announcement very soon. We are fully aware of the need to give enough time to parents and students for their plans. So I will probably be very soon giving an announcement regarding graduation.
Thank you.
I would also add to Provost Fuentes' answer, because that is one event. We have many events on campus. We are amassing and have amassed the list of events that we have that gather larger groups of people, and we are the same way assessing those, because all of those events require planning, travel, coordination, and logistics, and we want to give fair warning for any of those that might either be discontinued or postponed or canceled well in advance. So we're in the process of doing that currently.
Vanessa?
Yeah, just along with that, do you know if any athletics events are going to be affected by this 2-week thing?
And
Yes.
This question is regarding athletic events.
Please, yeah, thank you. Yeah, the question's a common one. I'll give you a specific statement from the NCAA, but right now, obviously, our athletic department is committed to the safety of our student athletes, coaches, staff, and fans. We would all expect that. We will continue to monitor the situations and recommendations from those national and regional state health departments. And at this point, there are no changes to what we are doing in hosting our events or traveling to our events. Regarding the upcoming NCAA championship seasons that are going on in several sports, the NCAA has released a statement, did yesterday on Tuesday, March 10th, regarding that. This is the statement from the NCAA. The NCAA continues to assess how COVID-19 impacts the conduct of our tournaments and events. We are consulting with public health officials and our COVID-19 advisory panel, who are leading experts in epidemiology and public health, and will make decisions in the coming days. So they are also assessing this, and it is something, as we've seen throughout this, a fluid situation where everybody's reacting to the latest and best information that we have. That's the statement from the NCAA, and obviously the University of Iowa will not only follow in what's happening with the NCAA, but remain coordinated and dovetail their decisions on that front.
Amy?
The patient at UIHC who has COVID-19, are you seeing any improvement in their condition?
This is regarding a patient at UIHC that is reported to have COVID-19 and their condition.
So with the ability to protect the privacy of the patient, I can give you very little information, but I can tell you that the patient appears better today than he was when he arrived last night.
Along with that, can you confirm that that patient is just one of the cases we already know about that was involved in the travel?
The patient was a traveler and was known to be positive prior to arrival.
Have you guys, has the University of Iowa done anything like this before? Is this the first time you've moved to online only for
This is-
outbreak reasons? Sorry.
No, I'm sorry. I'm just only repeating them for those who might be watching later, but this is whether the university has taken this step in the past or if this is the first time that we've moved to virtual or online education.
It would only be from recollection that we've closed. We've obviously had, thank you, we've obviously had situations in the past of emergency on our campus and altered how we were doing things. You may remember the flood of 2008. A lot of the university services, short of UIHC, were canceled or suspended. It happened that was not during an academic season of fall or spring, which was fortunate at that time. But we did alter class time scheduling to a, I'm not specifically aware of a going to online only event on our campus prior to this. Melissa, you may want to add or have background.
Yes, I want to add that this is going to be a significant amount of work to get there, and we're going to work tirelessly to meet that goal. So we know that everything is ready. We're going to work very hard to be able to meet that goal and make sure that we are able to reach the students and continue the delivery of their education.
And each type of class is a different type of class. Many may be not easy, but certainly logistically viable for online as easily as it may be in class. Others, lab classes and others, discussion kinds of classes, will be different and will be treated individually in those cases.
Is there a chance that, like Grinnell, that the university, if this situation escalates or doesn't get better, will do this for the rest of the semester?
The question was whether we would continue the online instruction for the rest of the semester if the conditions worsen across the state.
We are going to be monitoring the situation. That's what the statement says, at least until April. But we will continue monitoring, and yes, we could potentially continue extending if that's needed.
Is there any extra guidance for students going on domestic spring break travel?
This question is regarding domestic spring break travel and particularly as it relates to guidance for students.
I can talk a bit about travel in general. As we may know on the domestic front, the CDC has not issued specific guidance related to limiting domestic travel at this time. We know there are places in the United States that have more issues than others. We'll continue to follow those guidelines, the guidelines of the CDC, and others, including our Board of Regents, and continually monitor developments across the United States, again, with our primary objective of looking after the well-being of our students, faculty, and staff. And we will adjust travel guidelines should the developments take us in that direction. But at this point, there is no domestic travel restriction based on the guidance from the federal government and the regional and state health officials.
And it sounds like the UI hasn't decided how to handle classes like science labs that don't translate as well to online. What are some of the options that you're considering on that front?
Amy's question is, what are the options for handling classes like science labs or performance arts classes that are more difficult to offer online?
So right now, we are in the process of going class by class to determine what would be the best practice in each situation, and all the students will be informed. So we want flexibility and being able to reach the students and communicate with them what will be the form of delivery. So that it will be class by class. We are going through an inventory of all the classes and determine what will be the best strategy.
Okay, I would say they're asking students who want to stay in their residence halls to register online or using the form. Is Iowa asking students to do anything like that?
I believe we are, and I can get you that information afterwards, but I do believe that form is being set up now.
And do keep in mind, as we said in our statements, our campus is still operating. We're still operating the library, our recreation center, the CAM bus. So we still serve our students by offering and giving the students the option to stay remote, stay at home if their home is not here in the couple of weeks after spring break. It is to lighten the load on our campus, and so even in the classroom situations, the students will be interacting with fewer people, smaller crowds, which we believe to be a good thing. And some of those students don't have other places to go, and there could also be students whose homes may be in places that are more impacted than here. So we're certainly not shutting down the residence halls, the food service, and the services that provide the students with with the same environment, living environment and services they had before is offered.
What kind of planning has been done for facilities that will remain open that rely on a student workforce?
That's a great question. This question regarding the student workforce and how the facilities maintain their operations if students leave for a time period.
That's being evaluated right now. For example, the libraries. We do have a large number of students working there, so we are determining how we can move forward. So it's being evaluated, and we'll provide more specifics.
And there's no doubt, even, we run campus during spring semesters, summer semesters, and we have fewer students on. So workload and the work happening by the students is always something we're working on. In this case, if students are gone that would normally be doing the bus, the CAM bus staff are working with the employees who are all trained to be CAM bus drivers to fill out the schedules. There are no notices that would keep them from working. And so in that case, it's a matter of if they're on campus, there'll be the group of students that will be helping in the case of recreation center, library, campus, and other services where students are involved in providing those services as student employees.
Do you know how this would impact the federal work study programs? Is there any implications for that?
This question, I'm just going to repeat it for those who might be watching later on. Question about federal work study and whether moving to online instruction has any impact on those.
Or the services. It's a good question, Marissa. And in each of the pockets of our campus that are working with student employees, for instance, they are working with those students to secure that. Again, we're not suspending operations on the campus. The students that are studying, that are in courses this spring for the 2 weeks following spring break, will be able to take those courses remotely. But otherwise, we are operating, if you will, as what is it? As normal, with quotes around it. All of us are heightened attention, and as Dr. Brennan said, we are looking after all of the healthy habits that all of us should have in caring for ourselves, washing our hands, and recognizing when we're not feeling well. And whether it is the virus or the flu or the common cold, it's good practice to keep yourself from others if it's something that might be passed on.
Has there been any discussion about possible refunds for room and board or tuition if students do choose to stay home and not return to campus?
Will be evaluated, but it is offered to the students. It's not being taken from them. We're not closing down those operations. We're giving them the option. Certainly, any issues that may come up from our students' families, and others, we will be, and there are many of those. Residence halls could be one of those. We will certainly be evaluating with our officials, with central administration, with the experts who work in those areas to address them, but not specifically to your question.
I want to add to that we're also evaluating that for our students abroad who are asked to come here, and that's mandatory for our students here on campus. The resident halls will be open and available, so that will be their choices. But in other cases, we're asking them to come, so we're evaluating and we'll go case by case to see our top priorities to help the students. So it will be determined what is the best way to help them.
So, do you know how many students are going to be affected by that recall? The studies are recalled.
73.
73 total.
Yeah.
The Center for Instant has the Island Voyagers group that recently on March 3rd departed for
We would have to check with UI Center for Advancement. That was not the trip that was referenced in the Johnson County cases. So I don't think there's a connection, but I would definitely want to connect you with UI Center for Advancement. I know that program is run externally.
I will say we're in contact with the University of Iowa Center for Advancement. Obviously, they're an important part of the university, both community and our mission, and a lot of their staff travel a lot, apart from programs that might have travel. So they are working with our critical incident management team and remaining steadfast in protecting their employees and those that they visit on their trips. So they're being careful and evaluating the same. They're part of our list of events that we're evaluating are related to those that the University of Iowa Center for Advancement are evaluating.
I think we have time for just one more question.
Is there potentially any change to the way in which professors are paid or at the rate at which they are paid during this time?
Not at this point. They will continue delivering the education, maybe using a different strategy, but they will all continue to engage in the classes.
Thank you so much. If it's a quick one, I think it's.
I just wondered real quick if you could talk about whether this could potentially affect time of graduation for students if there are delays in like lab classes and stuff.
We are making a top priority that our graduating seniors are not impacting. That's a top priority. It could be the case that some students maybe in the first, second year and they choose and work with them, and maybe the load next year will be greater, so we'll be again focusing case by case. But I can tell you that it's a top priority for us to make sure all our graduating seniors, they are graduating.
Thank you for coming. If we did not get to your question, my team and I are happy to try to address those afterwards and get you responses. I just have to cut this off at this point, and I apologize, but all three of our administrators have back-to-back schedules today. So thank you for coming and thank you for your time.
Thank you.
Thank you.